are in listen-only mode.
Hello, my name is Karen Odegaard, and I am a Community Health Improvement Specialist with the County Health Rankings and Roadmaps program. I am joined by my colleague, Stephanie Johnson.
Hello everyone. I'm going to be chatting out links during the webinar today and helping to send out questions at the end of the webinar.
And we are also excited to have Megan Joseph and Fernando Giraldo with us today to talk about the link between health and crime and public safety. So welcome, Fernando and Megan.
It's a pleasure to be on the webinar. Thank you.
Likewise, it's an honor. Thanks for having us.
We'd like to start by acknowledging the important relationship that we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. Thanks to the support of the Robert Wood Johnson Foundation, we currently have 3 community coaches in the County Health Rankings and Roadmaps program, and their assistance is available at no cost to you. Please don't hesitate to contact us if you need assistance with a tool, have a question, or are trying to figure out the next step in your process. You'll find the orange box on the screen here throughout our website, so you can send us an email directly. We want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of 2 parts. On the left, you can see the viewer window, where you will see our screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. Please feel free to ask questions or to share your experiences and thoughts with us through the control panel during the webinar today. And you can see that highlighted here. We'll be sure to leave time for your questions toward the end of the webinar. Here's a quick look at what we'll be talking about today. We'll start with a brief overview of the County Health Rankings and Roadmaps program to help set the stage for our topic today. We'll talk with Megan and Fernando about how Santa Cruz County has worked with its criminal justice system and how that work has impacted health in the community. And we'll be sure to take time for your questions to help you put this information to use in your community. We'd like to begin with an essential question that you can keep in your thoughts throughout the webinar today. Today's essential question is, how can we define health broadly to build a culture of health in our community? We want to get a sense of how you're currently approaching health, so we're going to launch a quick poll asking you which health factors are your community's efforts aiming to impact. So you can select all of the options that apply. Are you working on health behaviors? Things like tobacco use, diet and exercise, alcohol and drug use, or sexual activity? Are you working on clinical care, things like access to care and quality of care? Or social and economic factors, things like community safety and income, education, employment, and family and social support? And are you working on the physical environment? That might be things like air and water quality, or housing and transit. We call these our rapid response polls to get a good sense of where you're at, what you're doing, and then to incorporate that into our webinar throughout the day today. So we like to get up to about 75%. We're right almost there. And then we'll close the poll and take a look at what you're working on in your communities. All right, let's go ahead and close that, and we'll take a look. So you can see that this is a great representation of folks working across the health factors. And we often see that there's maybe a little bit more activity in health behaviors, the area that we might traditionally think of as our work in health. But as we talk today with our guests about broadening this definition of health, we'll start thinking about how can we expand our work across those health factors to make sure that we're thinking about clinical care, social and economic factors, and the physical environment. Our guests from Santa Cruz County today will really be focusing on their work in social and economic factors. So we'd like to give you a few questions to consider as you listen to the webinar today to help you take action with this information. Who else do you need to share this information with? What's one idea for action that you're taking from the webinar? And what else do you need to know to take action or use this information? We want to give you a little background about the County Health Rankings and Roadmaps program to help frame today's conversation with Megan and Fernando. The County Health Rankings ranks the health of nearly every county in every state. For each county, you will find two rankings, one for health outcomes and one for health factors. We do this because we believe that there are two separate sets of messages to convey. How healthy a county currently is, the health outcomes ranking, and how healthy a county might be in the future based on the many factors that influence health, our health factors ranking. This image shows the relationship between policy, health factors, and health outcomes. It illustrates why it's important for communities to define health broadly. Many factors impact how long and how well we live. Things like how we commute to work, our housing conditions, access to parks and the quality of our schools, access to healthy foods, community safety, and our social connectedness. All of these things impact our health outcomes. So we saw from our poll that many of you are indeed working across these factors. And for some of you, it may be something that you're still working toward. For those of you who are more experienced with this model or who have been working across these different health factors, we'd love to have you share some of your experiences during the webinar today. And as much as we can, we'll share your lessons learned with others. So what does this image tell us? Starting from the bottom, we know that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. There are many health factors that shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes to show how healthy each county is, the length of life and the quality of life. The rankings give community leaders a tool for calling their communities to action. When the rankings are released each spring, they generate a lot of media attention, which provides community leaders with an opportunity to mobilize people from all walks of life to take action. Action that is evidence-informed and focused on the community's health priorities. Action that will ultimately, over the long term, result in longer, higher quality lives for children and adults in the community. The Take Action cycle is the how within rankings and roadmaps. It lays out the process communities follow to improve health. Start by gathering information to assess needs and resources, set priorities so you can focus on what's important, find the most effective approaches to address your priorities, and then get to work on acting on what's important. And of course, evaluating throughout the action cycle will help you improve your strategies and ensure that what you're doing is effective. You'll see that Communicate sits in the center of the cycle because communication with stakeholders is essential throughout the Take Action cycle. But at the heart of the Take Action cycle is people working together because we know that solving issues like childhood obesity, poor high school graduation rates, or crime and recidivism require the wisdom and the resources of everyone in the community. As you listen to our guests from Santa Cruz County, California, talk about their work, you'll hear how it very naturally fits with the Take Action cycle. The Roadmaps to Health Action Center part of our website includes guidance and tools to help communities keep moving along this cycle. Stephanie will be sharing links to some relevant tools and guidance throughout today's webinar. They'll also be posted online later this week. So we guide people to take action. We guide them to the Take Action cycle. We point them to tools and guidance on our website to assist them. But we also know that communities are already well along the way on this journey. And we wanted a way to identify, to celebrate, and feature these communities. And so the idea of the RWJF Culture of Health Prize was created. The RWJF Culture of Health Prize celebrates what communities have done as well as how they have done it. So here you'll see 6 criteria that are central to the Culture of Health Prize. These criteria serve as the lens through which all applicant communities' submissions are judged. The prize recognizes communities annually who work across health factors by defining health broadly. Communities that are strategically focused on policy, systems, and environmental change, and who look out for all, including the most vulnerable in the community. These communities work collaboratively with partners from across sectors. They use resources wisely and creatively, and they measure and share their success widely. You can learn more about our 2013 and 2014 prize-winning communities on our site, and Stephanie will be chatting those web addresses out to you now. I'm pleased to note that our guests today are representing an inaugural 2013 prize-winning community, Santa Cruz, California. If you haven't watched the inspirational video about their efforts, I encourage you to take 4 minutes, just 4 minutes, after our webinar today to check it out. And Stephanie will chat out a link to that now as well. So welcome, Megan and Fernando. Megan Joseph has been with the United Way of Santa Cruz County for over 3 years. She oversees the Community Organizing Department's long-term initiatives and has expanded the department's scope to include new initiatives such as youth violence prevention, smart solutions to homelessness, and addressing reentry issues for formerly incarcerated individuals. Megan has a BA in Criminology and Psychology from Indiana University of Pennsylvania, a master's degree from John F. Kennedy University in Consciousness and Transformative Studies, and is currently working toward a master's degree at UC Irvine in Criminology, Law, and Society. Megan's passion is engaging multiple stakeholders to jointly act to address critical problems affecting the welfare of neighborhoods and communities. Fernando Giraldo is the probation chief of the Santa Cruz County Probation Department and has been a probation officer with the department since 1995. Fernando has a master's degree in social work from San Jose State University and holds a bachelor's degree in Latin American Studies from the University of California, Santa Cruz. Fernando is also a graduate of the Annie E. Casey Applied Leadership Network, and in 2013 he participated in the inaugural class of the Santa Cruz County Leadership for Community Transformation through the United Way of Santa Cruz County. Santa Cruz County Probation is a nationally recognized model for juvenile detention reform and work to reduce racial and ethnic disparities through the Annie E. Casey Foundation. So welcome, Megan and Fernando. Thank you so much for being with us. Start us out. Thank you. Thank you so much for being here. And start us out by sharing a little bit about Santa Cruz County. Kind of set the stage for us.
Great, sure, I'd be happy to. So Santa Cruz County is a diverse community. We're located on California's central coast, and the northern half of the county is largely suburban. That's where the University of California, Santa Cruz is located, and our economy is really based on tourism and the university in that part of the county. The southern half of the county is predominantly agricultural and is centered around the city of Watsonville, a regional hub for farming and related commerce. Santa Cruz is the second smallest county in California with an area of only 440 square miles, and we have a population of about 267,000. Our ethnic composition of the community is 59% Caucasian and 33% Hispanic or Latino. And about 26% of our population speaks Spanish at home as of 2012. As far as the county health rankings go, we're ranked 11th in the state. And as far as United Way, we've been in this community for over 70 years, working to make well-being accessible to all through both our community grants program and also through our strong community engagement initiatives that work to go beyond not only meeting immediate needs, but solving the root causes of issues and creating sustainable change.
Great. So as we just saw, one of the criteria for the RWJF Culture of Health Prize is to define health in the broadest possible terms. Can you talk a little bit about what that means for you in Santa Cruz County?
Sure. When you talk about health in the justice system, you must think broadly, and this goes beyond physical health. You must think about mental health, and substance use disorders, housing, employment, behavioral health, and many other critical issues that face our clients. We understand that these issues are key drivers of criminal behaviors. If we can address these issues, we can reduce criminal conduct, reduce recidivism, and improve public safety. The Affordable Care Act has also given our community an opportunity to enroll many justice-involved people who were previously uninsured into health care Medi-Cal, which is the California version of Medicaid.
Yeah, and we've been using the county health rankings and roadmaps health factors model at United Way as a lens through which we view our community and define health for a long time. So we define health very broadly, as Fernando mentioned, through these terms of not only health care or physical health, but also mental health, environmental factors, educational attainment, employment, public safety. We're really looking at all of those. And using this broad lens has led us to create initiatives that address a range of issues. So we're looking at everything from obesity to youth violence prevention to incarceration and homelessness.
That is indeed quite a breadth of work. Can you talk about how these issues rise up as priorities for your community to address?
Sure. So there's really two primary ways, if we had to narrow it down, that issues rise up in Santa Cruz County. One is through what the data shows. So you'll see the cover of our community assessment project on your screen. And that's one way that we look at what issues are arising in our community. The community assessment project's been in place in our community for 20 years. It's one of the oldest running comprehensive community assessments in the country, and it allows us to track trend data over time. So we've got both secondary data in there, like census data, but also we have a primary data that we've developed through an every other year phone survey of our residents. So this data has allowed us to keep a pulse on how our community is doing and our perception of how we're doing. This is, for example, how our childhood obesity work began. So on the other side of that, many of our justice initiatives have arisen out of community concern, which is another way that we see what issues are rising up in our community. So over 17 years ago, we had community concern about rates of incarceration in our juvenile hall and overrepresentation of Latino youth. This led to extensive reforms, including building community capacity for alternatives and creating a more balanced approach that included a focus on prevention, intervention, suppression, and reentry. So the whole continuum. And then more recently, we had the statewide policy change of AB 109, or public safety realignment. And that combined with a tragic incident locally of 2 police officers being shot and killed really rose community concern regarding public safety in general. The community really looked to the justice system at that time and was asking, how are we going to respond to these changes and incidents in our community? And this drove us, as in United Way, and many justice system stakeholders and community stakeholders in general, to get involved in creating a system and community-led response, which we'll talk more about.
Yeah, so let's move into that a little bit. You know, you mentioned that there was a statewide policy change. There were some local tragedies that really prompted your work with adult incarceration, and I can imagine that so much of the work that you've done with juvenile justice, the lessons that you learned there, the credibility that you built with that work, then influenced your work going into adult incarceration. So can you talk a little bit about what was happening in the community that led you into this work around adult incarceration and what you did?
Sure. Let me step back and give you a little context about the AB 109 Public Safety Realignment Act of 2011 so you know what it means going forward. AB 109 legislation was based on a series of lawsuits related to medical and mental health services that resulted in the U.S. Supreme Court ruling that prison overcrowding in California had led to deficiencies in medical and mental health care services within the prisons that constituted a violation of prisoners' 8th Amendment protections against cruel and unusual punishment. So here's what it did. Under realignment, Santa Cruz County assumed responsibility for 2 offender populations who were previously the responsibility of the California Department of Corrections, which is our prison system here in California. Lower-level felony offenders sentenced for non-serious, non-violent, non-sexual offenses being released from state prison to community supervision by the Santa Cruz County Probation Department, known as post-release community supervision, or we call them locally the PRCS population. These folks are now supervised probation, and formerly they were supervised by state parole. And we have the non-serious, non-violent, and non-sexual felony offenders who are being sentenced to a new prison sentence that will be served locally. So let me tell you how we implemented these changes locally. An AB 109 requirement was to convene a community corrections partnership with key stakeholders to develop a plan to address our new population. Santa Cruz viewed AB 109 as an opportunity to do better for our own community members. Some communities decided to build more jail beds because we had a new population realigned to the county. Some, like us, focused on building community capacity, taking lessons we learned in our juvenile reform nearly 2 decades ago. We learned this from our juvenile division. We collaborated with Santa Cruz County Sheriff's Office to develop and implement an additional electronic monitoring program for sentenced offenders who pose a lesser risk to the community and have been convicted of less serious offenses, or they may have special needs or problems that may be better handled in their home environment.
And from the community organizing perspective, AB 109, as Fernando mentioned, was a huge shift for California and for our community. And suddenly all eyes across the nation were on us and how this huge shift was going to be implemented. And at the same time, we saw that the media was starting to portray this as potential chaos. It made for good headlines that prisoners were going to be released in droves to the streets and that crime would be on the rise because of it. So locally, we took advantage and leveraged some assets that we already had. We had convened a group of stakeholders already, ranging from UCSC professors to local justice system stakeholders, lawyers, and beyond. And they were able to respond to this growing public concern by hosting a community forum. And this first forum was attended by over 200 residents. And it really highlighted how improving outcomes for people reentering from incarceration can actually improve outcomes for the entire community. And that adults, just as we learned in the juvenile system, adults also need not only physical health, including substance abuse treatment and mental health support, but they also need positive social support, employment, housing, family connections, all of those things that make somebody successfully reenter into the community. And we also jumped on the opportunity to create a community education and engagement work group of our community corrections partnership. So as Fernando mentioned, that's the body here in California that's locally required to implement AB 109. So this group of community education people did a couple of things. One of the biggest things we've done is start a speakers bureau, and this has really helped us communicate a message. We've trained formerly incarcerated individuals to effectively share their stories and help inform the community from their perspective about what factors led to their incarceration, so their social history, and then what worked to help them reenter, so helping us better understand what was working for them. And we've got trained 30 participants now, including 10 who are actually still in custody at our local jails. So we really enjoyed being able to go into our jail for the first time recently and do that program there. We also followed up the original forum with a series of 12 community conversations. You'll see the flyer on the left-hand side of your screen there. And we held these at community centers and churches and educational settings and many venues across the county. And within a year, we had engaged over 700 in hearing from local stakeholders, learning the facts, dispelling some of the myths that were out there about this change, and then letting them express their views and concerns in small groups. We were able to really further raise awareness of the benefits to the community at these events of serving justice system clients better in order to reduce recidivism, but ultimately also to increase the entire community's safety and well-being. So essentially, it's sort of one of the mottos we have around this in our entire community is when one rises up out of criminality and into successful transition into the community, we all rise up. So these public venues also provided an opportunity for our local officials, and especially our sheriff, to declare publicly that he would not build our way out of this problem by creating more jail bed space. And that's not true in every community in California, so we're really lucky to have a forward-thinking sheriff and other stakeholders that are committed to that. And instead, he publicly declared that we would meet this problem differently. And out of this commitment and the public support, I think he was able to garner through some of those events. The Custody Alternatives Program was born, along with a lot of other services for clients of the justice system.
That's great, Megan. So it sounds like a lot of the work that you did, the role that the United Way played in this effort, was to help bring the community support piece to make this policy change happen. From the community conversations and the community forums to getting the stories out there, really helping to bring and build that support among the community, and not really so much in terms of working with or trying to convince or persuade policymakers to make the change, but it was really bringing the community along. So can you talk a little bit about what has happened as a result of this change in this work? What's been the result of the custody alternatives initiatives?
Well, it continues to be really successful, and I'll talk a little bit about the Sheriff's Custody Alternatives Program that probation also has a role in. During the first 2 years of the program, and that was October 2011 through September 2013, there have been a total of 581 participants, and obviously that number has grown to the present. Success rate, I can tell you, of those 51 of those participants, 9% were returned to custody for program violations, and only three participants, which is less than 1%, absconded. And our measure of success really is that they make all court appearances and don't recidivate. So with high public safety indicator right there. Approximately 57 inmates per day are in the CAP program. That means they're not in custody. They're able to continue work, stay in their home environment, support their families, and stay connected to the community, which is, we believe, in our best interest. In 2013, you translate to the dollar amount of bed days saved, the county saved over $1.7 million alone in just in 2013.
That's great. It sounds like it's been, there have been a lot of successes with this work. What about challenges? What kinds of challenges have you faced in doing this work?
Well, as with any change, there's always challenge. And at the beginning of AB 109, I think lots of people thought the sky was falling. There would be mayhem, as with other changes in justice policies, but we haven't seen that. The sky hasn't fallen. There has been a tendency sometimes in different arenas for folks to blame AB 109 for crimes that occurred or any temporary rise in specific crime categories. But it's not supported by data. That data is so important. And it's just anecdotal information. What people need to realize is, again, is the sky is not falling, and early indicators show that crime is not increasing despite opinions. AB 109 is the new justice landscape here, and we need to successfully navigate this reality. Just one other challenge, and there are a few others, of course, but funding is a challenge to our community that supports the three goal areas of AB 109, which are alternatives to incarceration, effective supervision, and, of course, treatment and intervention services for the new population we're serving. But as we move further along in the process, we are realizing what services we need more of, and that always comes with a price tag. So funding is another challenge.
For sure. And then from the community engagement perspective, as Fernando sort of mentioned, we're still battling this notion that AB 109 is detrimental. And this message, we continue to see it portrayed in the media and by some parts of the justice system. And naturally, community members become concerned when they're seeing that message in the media over and over again. And change is hard. I mean, it's been challenging to bring everyone along and to figure out this huge new system and way of doing things in California. So we're continuing to support that change in the community. We're continuing to tell a different story, and our Speakers Bureau has been a big part of that. The pictures on the screen are our Speakers Bureau participants in action there. And they're continuing to portray their success stories, and we continue to work with the media to relay accurate data and information. And we're continuously working together to make systemic improvements. I think one of the things that stands out in Santa Cruz County is our ability to work together across sectors and across fields to really make a difference in a lot of ways that is unusual, I think. So we're really lucky to have the community that we do here.
Thanks so much, Megan and Fernando. And this is Stephanie. I wanted to share a question that has come through. You've talked a little bit about the juvenile justice work, and we've got some interest in you sharing a little bit more about that work. Can you talk a little bit more about the juvenile justice work that you're involved in?
Absolutely. Let me tell you a little bit about that. We began our juvenile detention reform through the Annie E. Casey Foundation, the Juvenile Detention Alternatives Initiative. Nearly two decades ago. It was about 1996. This was a response to an overcrowded facility, long lengths of stay, and a disproportionate number of Latino youth that were being held. Systems in those positions often have two choices when they're overcrowded, right? You can build a bigger or new facility, or you build community capacity, which is to develop alternatives to incarceration. Whereas many folks decided to build themselves out of the problem, I believe we were smart and decided to develop alternatives to detention for low to moderate risk youth. Today we reduced our detention population by more than 50% without jeopardizing public safety, and this has been done through successful community-based alternatives to incarceration, such as home supervision, electronic monitoring, evening centers, and just a robust continuum of services. We've drastically and safely reduced the number of youth who are in detention by implementing many years ago an objective risk instrument that's predictive in nature and expanding this community capacity. The risk instrument really is used to help you determine who should stay and who's released in your juvenile hall, and really validated instruments guide you to really detain only those that pose a serious risk to recidivate and not show up for court. And that's just a small number of youth. Most youth can be safely released straight to the community or maybe on some supervised type of program.
Great. And just from our perspective, I think what's unique is that Probation and the United Way of Santa Cruz County and many of our community partners have a common goal, which is public safety and the health of our entire community. And we actually don't consider those to be two separate goals, which is, I think, the theme here today. So a healthy community is one where people have access to physical health and health care for sure, but it's also one where community members are and feel safe to play in their parks, to walk to school, to hang out in their neighborhoods. And a healthy community is one where youth can stay in their communities, stay with their families, fully participate in school, and build those positive social supports that we know are so necessary for successful transition into adulthood. So all of these desired conditions require that the community and the justice system work together to optimize the outcomes for the justice system-involved youth and adults alike.
So Fernando, can you talk a little bit about some of the results that you've had from this work?
Yeah, so you can look, there's a slide that you should be able to see, and 1996 is the year before we were deliberate in really starting our detention reform. And there's really 8 core objectives or 8 strategies that you have to implement and or use. But first of all, the data is of extreme importance, because you need to know who's coming into your juvenile hall, who's bringing them there, why, who are they, is it the schools, what neighborhoods, and so on. Then you start working on implementing objective risk assessment instruments to help you determine who stays and who doesn't. You develop alternatives to incarceration. You work on conditions of confinement for those in your detention population. But you'll see in 1997, we have a 42-bed capacity juvenile hall. And in 1997, 1998, we were over capacity almost 365 days a year. But quickly, you can see the drop as you progress, through 2013, where our average daily population was just 21. And you need to keep in mind that our capacity is 42, so we are well under that, which is safe. We really, there's all indicators, and there's so much research about the harmful consequences of unnecessary incarceration, that it's harmful, that 2 similarly situated youth, basically with similar charges, but one goes into detention and the other is diverted out of the system. And the one that experiences detention will have poor outcomes through their lifespan. So it's really important to think smartly about how you use your juvenile halls, and this applies, of course, to jails as well.
Thanks, Fernando. You can you can just so clearly see how the successes that you had here in your work around juvenile detention and juvenile incarceration, how that did end up playing into the work that you did with the Custody Alternatives Program. You can just see that those lessons learned really played out as you began working with the adult population. I know Stephanie has another question from the audience. I'm going to turn over to Stephanie.
Thanks, Karen. So some people are noting that criminal justice data is difficult to find and it's challenging to interpret in their communities. And so this question is wondering what kind of data you use to help you understand the issue and your impact.
Sure. One of the first things you need to do is define what are you going to measure, and so let's just go back to the simple point of recidivism. That's really what people want to know. How are your people that you're serving, whether it's probation, are they then recidivating subsequent to supervision? So we had to work hard, and it took a while to actually even define what recidivism means, but you have to come to consensus on what that means. And for us locally, we defined it as a new conviction following release on community supervision within 3 years. And so, but that took a while. And in fact, the state of California has just, after many, many years, actually defined what recidivism means. But as part of our Community Corrections Partnership, which informs and drives the implementation of realignment, we have a data work group. And these folks have gotten together to really identify what's important data, what are indicators of success related to our, not just our AB 109 population, but the entire criminal justice population. And it's moving just beyond arrests and convictions, but how are they doing in terms of their risk and needs? Because we assess all our probation officers using all our clients using a tool that identifies their criminogenic needs as well as the protective factors, and we want to focus on those needs, which it's mental health, who they're associating with, where they're living, their antisocial thinking patterns. So it's really using effective practices to drive that and get better indicators. But we have a lot of capacity. We've built that up to collect data. It's not easy, and it takes a lot of work. But first is really coming up with common indicators that people can agree on that are meaningful.
Yeah, that's great. I just want to take that opportunity to highlight a data report that we've released. We haven't really talked about our youth violence prevention effort, but we are in the middle of a strategic planning process countywide for youth violence prevention, and we've brought together a lot of different stakeholders to be a part of that. And we produced last year as a first step a community assessment, and we feel it's really important to assess where we are before we move forward and decide where we want to go. So we did a comprehensive data report on youth violence, and it really provided a snapshot of the community on not only things like crime rates for juveniles or arrest rates, but also things like educational attainment, safety at schools, family engagement, whether they feel they have an adult that they can turn to. So a lot of there are about 60 different indicators that are related to youth violence. So I think data, crime data can be really challenging to work with, and you can really look at a piece of crime data and interpret it in any way that will serve you, which can be great sometimes, and when others do that, it's very frustrating, and it's hard to really get the truth and the facts out to the community about what's truly happening. So I think it needs to be looked at in the context of other indicators and factors that are going along with that one or two pieces of actual criminal justice data.
Data, one last thing, data has been really important in our juvenile reform and currently in our adult reform, because when you look at that chart that's still there, you see the detention population drastically being reduced. Well, the criminal data in terms of felony convictions, misdemeanor convictions have also been tracked, and those numbers have been reducing. So what that shows is that we've been able to safely reduce the use of detention without jeopardizing public safety. Had the trends gone up the other way of felony, misdemeanor convictions and so on gone up, it would have been hard to justify. But generally, there isn't much of a correlation between the two. But we've been able to reduce detention and really have dropping levels throughout California, and I think throughout the the nation really in juvenile crime. Most juvenile crimes, though, there's always little areas that go up and down, but overall it's gone down.
Sure. Say, this is Stephanie again. There was a question that came in from Keenan while you were talking about the data, and I think this is a really great question. What are your plans to measure outcomes for the children of people diverted from incarceration?
So we have a number of indicators that we look at for children that aren't. The first indicator, if a child is put out on an alternative to detention, the public safety indicator there, the basic one, is whether or not during that court process that they made it to court and that they didn't recidivate. And so I know going back since 2000, we have a 94% success rate right there, and that speaks volumes. It's really saying that you were able to in the community and not behind bars through the court process and still have them show up to court and not recidivate. So you really would have wasted your time had you held them in detention. But the other indicators that we look at are, as we assess youth to do case plannings to identify risk and needs, we're looking at the work that we do. Are there areas of risk going down, criminogenic needs in terms of antisocial thinking patterns, school behavior, school attendance? Are they increasing in their school attendance? Employment issues. A lot of what we do is based on a positive youth development framework. So it's looking at the indicators that show a successful transition into adulthood. So it's school-based, employment-based, even for youth. That's an important piece, and connections to positive adults. And a lot of this is also measured. It's also qualitative through a lot of surveys that we every couple of years. I think most youth in this community take these surveys, and they tell us about what they're thinking, what they're doing regarding substance abuse, mental health, violent behavior, how safe they feel. So that's important to look at the whole picture.
Great, thank you so much, Fernando. We're going to move into the audience question portion of our webinar in just a moment, but before we do, I want to ask for you to talk a little bit about what winning the RWJF Culture of Health Prize has meant for your community. As we mentioned earlier in the webinar, Santa Cruz County is one of our inaugural 2013 RWJF Culture of Health Prize winners, and I'd just love to hear you talk a little bit about what that has meant for your work and the community in Santa Cruz County.
Great. So yeah, the prize has been, I mean, first of all, it's a huge honor, and thank you. And we encourage others to apply. It's really allowed our community to come together in a way that we hadn't before and take a look at why what we are doing works, first of all, and then where there's still room for improvement. So often I think we get caught up in initiatives and the passion of trying to create change in our communities that we don't stop and identify the why behind what's working and what might still be missing. So it gave us time to pause and really look at that. The prize has also given many folks in our community the opportunity to share our story and learn from others as well, locally, statewide, and nationally. In the pictures you'll see our local City Council in Watsonville accepting the prize plaque when we did it locally. That's our group at the top accepting the prize in New Jersey with the Robert Wood Johnson Foundation. And then on the bottom right is our some of our Jovenisanos youth leadership group visiting Washington, D.C., which they were invited to do because of the prize for a conference there. So we've been able to attend a lot of conferences and events and things, so we're really grateful for the opportunities that keep coming with the prize.
And we are so grateful to you for sharing your story with us today. I mean, the lessons that you've learned in your work with juvenile justice and your work with the adult incarceration are really powerful stories to share with others around the nation who are thinking about how they can approach this work. I want to ask the audience to continue to think about who else you might share this information with. what's one idea for action that you're taking from this webinar? And if you want to share that with us in the chat and question field, we'd love to see that, to see what you think you'll do as a result of this webinar. But we also want to know what else you need to know to be able to take action, to be able to use this information. So we've got some questions coming in from folks, but please let us know what else you need to know. What other questions can we answer for you in the time that we have remaining? And I'm going to look to Stephanie now to see how we're doing for questions.
Thanks, Karen. Well, we've got a few questions coming in, so thank you to the audience. Here is a question that could either really go to Fernando or Megan. How do you approach violence in a collective way, including all sectors of society?
That's a great question.
It's a big, broad question.
It is. And it's a great question because I think so many times in our communities things are siloed, and especially with the criminal justice system, even within that system there's a lot of silos that need to be broken down in order to come to these common understandings and common definitions that Fernando was talking about in order to move forward together. One of the ways that we've done that is really using our community assessment project and other data as sort of a North Star, we like to call it. So being able to land on what's happening in our community, and you can't really argue too much with a good piece of data. So with that in front of you, you can really begin to tell the story of what's happening in your community and have people come walk with you behind that piece of data toward that North Star of where you'd like to see that trend go instead of where it's going. And I think we've done that over and over again in our community on a lot of different issues, and most recently with our youth violence prevention work, again, we're bringing people together from all different sectors of the community. We have people from education, the justice system as far as law enforcement, probation. We've got youth involved. We've got former gang members. We've got service providers. So every sector is represented, faith community. And they're working on an array of issues, so we're really not just looking at youth as the issue. We're looking at youth as the asset and looking at it from a positive youth development approach. So how do we work together to make our schools a safe place and to make the routes to schools safer, and our neighborhoods safer for youth to play in, and our families more engaged in our schools? How do we work with youth to have positive peer mentorship and also a positive adult in their lives? So really looking at this from a very holistic approach. And then we're also looking at more traditional aspects of it, like community safety, recidivism rates, gangs, and things like that. So it's really important to us to look at that spectrum of prevention all the way through to reentry and making sure that we're being really inclusive in that model. Fernando, do you have anything to add?
Yeah, I just think, like you said, it's so critical to be inclusive, to bring everyone to the table, because it's easy to really maybe not invite the ones that are resistors or not necessarily champions, but you have to have them there. You have to do your outreach, because once those folks feel heard, you'll get a lot of buy-in. Not everyone will agree or necessarily, but we've also taken the opportunity as we develop this plan really to talk about some important things in the history in Santa Cruz about what's worked, like our detention reform initiatives, like what we're doing to enroll folks in health care. So these, you just have to make sure everyone is aligned, and because what you don't want coming out of the other end of developing a plan is for folks to say, I wasn't at the table, we don't disagree. So we have been deliberately in reaching even hard to reach communities, our migrant farm working communities, going out to schools where folks are primarily Spanish speakers or parents, and having focus groups there. So we're trying to be inclusive in that process.
Thanks for the great response. And another question came in while you were talking. This is from Rosie, wondering about the role of the faith community in your work. Can you talk a little bit about that for us?
Sure. Well, from this perspective of the youth violence prevention work, they're a key role in both organizing the community and having access to a broad swath of the community that normally aren't involved in these issues, and being able to activate their communities, but then also being able to provide services that are very community-based and relevant to the youth that are attending their churches or are there in those neighborhoods. Because this work is it can be county-wide, but then at some level it also has to be very neighborhood-oriented because that's where the youth are. And so because churches are so place-based, they're able to provide unique services as far as mentorship and after-school activities and things like that. So they get involved in both the community engagement and organizing, but then also in the providing direct services. So they've been involved in our work groups and actually in the planning process to help us decide which results we want for our community and what the story behind that trend is, and then what are the strategies that are going to get us to where we want to be. Anything to add?
No, I think you really said it all perfectly.
Thanks, Megan. So there's another question that came in, and you referenced silos a little bit ago. And this question is getting at suggestions that you might have on how to start the conversation and break down well-established or seemingly successful silos that work alone. How do you start bridging those conversations and breaking down silos?
Some of it, the history at Santa Cruz, which I've had an opportunity to host a lot of other jurisdictions or travel around, it seems to be unique, but hopefully that's changing, is that we have really strong partnerships here. And really that work together. Often sometimes it's around funding or lack of it, and folks realizing that we need to share the scarce funding that's available, and that's brought a lot of people to the table in terms of looking at applying for grants. What are new innovations can we bring into the community that will successfully help us with our youth and adult population? But I think like any relationship, we look at it as relationships just as much as you would in your home with your family members. That these relationships that we have with our partners need to be nurtured and taken care of, and you have bumps in the road. Sometimes you have trust issues. But it's really, first of all, having the value that these are important. And for me as a chief of probation, I know that I'm not going to alone successfully reduce recidivism. I need my partners. I need the community. I need community-based agencies. I need the faith-based groups. So with that in mind, and that's how my predecessors have also thought, and so do, of course, our law enforcement partners and other stakeholders, we just need everybody to work together. That's the only way that we're going to have a safer and healthier community.
I think just to be really specific with an example, we have bringing people together around criminal justice issues can be tricky sometimes because there's so many different ways of looking at that. And so we've had definitely some bumps in the road in breaking down some of the silos between community groups that are really focused on making sure that people are held accountable through punishment, breaking down silos between youth perception of law enforcement and then law enforcement wanting to be at the table with some community groups or nonprofits that they have the perception that they're really trying to assist gang members and things like that. So we do have issues for sure around trust issues and working together effectively, but I think we've created one thing we do is we name those. We don't let them be these invisible dynamics that are behind the scenes, but really bringing them out and being able to address them transparently and creating opportunities for people to work together on specific things to create a trust there and an understanding of each other. And when there's a common goal that everyone can agree on, and it may not be your biggest or brightest North Star, but start small with some common goal that everyone can agree on, and that really creates an opportunity to open some of those doors.
Thanks to both of you. That's a really great response, and I really like your North Star reference. I think that's a nice analogy to keep in our minds. So we have another question that came through, and this is from Marco. He's wondering if the coalition at a later point might have the ability to pivot and address other related or maybe new community concerns. And have you built the infrastructure and trust to do that and to maybe pivot and make a shift?
Great question. So I think that's starting to happen actually in a small way within our community education and engagement work group. We've started wondering and asking the question of what myths are still out there even within our service providers, and what are the issues and the sort of gray areas that aren't being addressed, because really AB 109 is 10% of our criminal justice involved population. So the question we're beginning to ask in that work group is, what about the 90%? What's happening with this other 90%, and what are some of the things that we've learned from the wraparound services provided in AB 109, but also wraparound similar services in our juvenile justice, in our homelessness work, in our another initiative here, downtown accountability program. There's a lot of different sort of wraparound service, holistic approaches that have happened that aren't necessarily accessible yet to the rest of our criminal justice population. So we're starting to ask that question of what have we learned so far, and how can we expand some of this work and, like you said, pivot toward addressing this other 90% and their needs in the same way.
Yeah, I couldn't agree more, and I think that's a great question, very forward-thinking. How do we leverage what we've been developing? Because right now I think we're at a really almost historic point in Santa Cruz. I've been at least working in this within the community for 25 years, but the number of initiatives with people that are working together, looking to achieve results, identifying results and using data, it's taken a while to get there, but people are really committed. So I think we're on the cusp of even doing greater things, and so I think we just need to continue to harness the energy that exists and the enthusiasm, and that I think is really largely due to including people that may have not come to the table before, and inviting them and not shutting the voices down that may have different opinions, but bringing them in. So we plan to continue this, because unfortunately there will always be issues around health in general in our communities, and so we need to work hard.
And just really quickly to address the infrastructure question, something that we're using, and actually for United Way anyway, we're using in all of our initiatives to build that infrastructure. It's called results-based accountability. It's very linked very tightly to collective impact. There's a lot of information out there about that. But we've been using that model to build consensus and structure for each of those initiatives, so they're very solid and everyone's sort of moving together on the same ship.
That is fantastic. I want to thank you so much to Megan and Fernando, to Stephanie for facilitating our questions, and to the audience for such fantastic questions. This has been a really great discussion, and we're going to bring it to a close now. So we want to encourage folks to stay connected with us. You can follow us on Twitter. You can like us on Facebook. You can sign up for our e-newsletter. And you can sign up for our e-newsletter by emailing us at chr@match.wisc.edu, and we look forward to communicating with you that way. As we mentioned at the beginning of the webinar, the County Health Rankings and Roadmaps program is the result of the contributions of many partners, and we like to end by including them here. We are so grateful for the Robert Wood Johnson Foundation support, which allows us to bring this webinar to you today. And at the beginning of the webinar, we asked this essential question. We hope that you found some answers, that you are thinking about ways that you can define health broadly in your communities to build a culture of health. And we want to thank you so much for your time. And Megan, Fernando, thank you for your expertise, your great story, and all of the work that you're doing in Santa Cruz County.
Glad we could join you.
Thank you.
Thanks.